Hi, my name is Jim Decker, and I was solicited to come and talk about men and breast cancer. And I had breast cancer 3 years ago. I'm cancer-free for 3 years, but very specifically, the process is what intrigued me to begin to look at the research, what was going on and what wasn't going on. And what I discovered as a man that men are not treated at all. Men are not looked at from the breast cancer world. It is a woman's world. But I guess the biggest thing that, well, there's quite a few things that are important. The first and most important thing is that there will be 2,500 men diagnosed with cancer this year, but there's a death rate of 25%. And that's because they don't get diagnosed till it's stage 3 and 4. And part of the problem is that men don't know what to look for. Primary care physicians don't know what to look for in a man. There are certain signs and symptoms that men have, but it basically goes undiagnosed. You know, on the other side of the coin, you know, it's just 1% of the population, and one can say, well, it's 1%, it's not a big deal, but it is a big deal. And it's an interesting phenomenon because when and how I got diagnosed is unique, but it's typical male. I went to have my yearly physical, and I had a nipple that was darkened. And after I had my physical exam, what happened was that my primary care doctor didn't even notice it, and I asked him about it. I says, well, what about this? This looks strange. And he looked at it and said, well, I think you should go see your dermatologist. And that's something that I thought was interesting in being typical male. I had a 3-month appointment for my dermatologist, so I didn't do anything about it. Men don't seek out medical services the way in which women do. So I waited 3 months. I went and saw my dermatologist. He did a biopsy, and because they really don't do a lot of breast cancer, they do mostly skin. And he sent it to the lab, and the lab really didn't even see it that much. And so they sent it back inconclusive, but said, see a breast cancer surgeon. And so when I got that back, I made an appointment with an expert here in LA. Do you want his name? Yeah, Dr. Giuliano. And Naomi was at that time his fellow. And so I went in, and this is where it's interesting for men and the alienation that goes with men. The first thing is we pull up to Cedar Sinai. I get out of the car, we get out of the car, and my girlfriend's with me. And the parking attendant says, you take very good care of her. And I'm the one with the diagnosis. So then we go upstairs and check in, and I check in. And obviously I'm a male, I'm the one who's checking in. We go to sit down, and one of the helpers come over, offer Nina water, offer her books, ask her if she would like to take this screening test for cancer, for breast cancer. And I'm sitting there. Then it becomes, for me, it becomes sort of hysterical. It's the only way I can look at it as funny, because it's like a joke. So the nurse comes out and asks for Mrs. Decker. And I just sort of look at her and say, excuse me, do you mean, Mr.? Oh, yeah, and it's right there. I mean, my name is there, on the form is there. Obviously, I'm a man. We go back, and they interview me and take a look at my body, my breast, and it's inconclusive for them as well. the breast cancer. Then they say, well, we don't have the pathology reports. Can you get them for me? And I think this is an important piece as well, is that I'm not sure they would ask a woman to go to the lab to get the results of the biopsy. But they asked me, and I said, sure, I'll go get them for you. Got the lab reports, brought them back, and I was diagnosed as stage 2 breast cancer. Then the process began of going to set up surgery and what we do. And then the nurse came in, the nurse practitioner came in and gave me a very beautiful leather pink binder. And it was, I liked the leather. The pink was sort of weird. Everything in there said nothing about a man. There was no information related to me at all. It had good information, and that information served me in different ways. But then 2 days before, they brought me back before the surgery. They wanted me to go through all of these tests, mammogram, CAT scan, PDT, a bunch of them, and I had no clue what any of them were. And so I go in for the mammogram, and I am positive that I was the first man that this woman had ever seen to give a mammogram to. She just didn't know what to do with me. And we got through that and went back. And then after that, I had surgery. And then the first thing that we talked about was right before surgery. I asked about reconstruction surgery. And I was informed that men didn't get reconstructive surgery simply because, we didn't need it. It wasn't going to be that deformed. But if you look on television and if you look at magazines, men's chests are there. They're predominant. Abs are there. But I wasn't even given access to reconstruction. And when women have breast cancer, they talk about reconstruction with women and what it could be, because it was going to deform my body. And